Why do we torture ourselves with mountains and mountains of information about the same topic over and over again? Facebook, Instagram, Google, YouTube. Repeat, cycle over and over again. What good is reading about a meteor before it hits the rock, if the rock is still in its path? Maybe you could think about what direction to scramble in. Or you can gather up your momentum and meet the meteor head on.
Hospitals are really vulnerable. They just don't have the capacity to deal with this pandemic. What are you hearing right now from folks on the ground?
Hearing at hospitals that they are very concerned about getting inundated with patients, and that's part of the reason that they're trying to.
You acting normal, things are so crazy, but people are definitely, social distance. We're outside.
I sensed in Washington, D.C. that maybe people were getting out for a final weekend before things really closed down. Maybe that's what's happening in Chicago too.
Yeah, I would imagine people are getting some sunshine.
So I'm a primary care physician working in a medically underserved area with predominantly Black and African American patients. I work mostly with seniors, Medicare patients age 65 and older. A few of them are younger than that, but they all have serious illnesses, chronic medical conditions, heart disease, lung disease, diabetes, stroke, kidney disease, you name it. So even before this outbreak, they were all very fragile and had a lot of serious chronic conditions that we were trying to manage in the attempt to try to keep them out of the hospital and keep them healthy overall. And now with this, obviously things get a little bit more complicated. So a typical day for me during this COVID-19 outbreak, I get to the center and right when you get in, one of the medical assistants checks everybody's temperature that walks into the door. If you have a fever and you're a patient, then you have to be evaluated and screened for other symptoms. If you're an employee and you have a fever, then you cannot come to work and you have to go seek medical attention right away. These days, I think the general philosophy for our clinic and a lot of clinics across the country is that we're just really trying to limit any traffic in and out of the clinic as much as possible. We want to keep patients away if they don't really need to be there. Only maybe handle emergencies within the clinic, but this is a time to really try to employ telemedicine and just kind of try to evaluate patients virtually over the phone and still take care of other medical issues that they may have without them having to actually be in the clinic. We want to keep them away as much as possible because as much as we try to be sanitary and maintain sanitary conditions, there's always going to be some kind of risk anytime a senior citizen walks into the clinic. They can always encounter some kind of germs, be exposed in some way, shape, or form. And we just don't want to take that risk. You come into the clinic, you check in, you get taken to an exam room, you get evaluated. I come in, try to wash my hands, and then I touch you with my stethoscope. All these different steps are just kind of putting them at risk. And they really are rolling the dice these days when they do come in for an evaluation. And that's the case everywhere. So we want to keep them away as much as possible and try to see what we can handle outside of the clinic. So a lot of my days are just doing telephone visits where I call the patients that are due for routine follow-ups and I just call them and see how you're doing. We discuss some of their chronic medical conditions, and then a lot of them have questions about COVID-19, so we talk about that as well. I give them the spiel about all what precautions they need to take. A lot of them are hearing about it in the news and they're taking it seriously, and they really are doing everything that they say to do, whether it be social distancing, washing your hands and maintaining good hand hygiene, keeping a distance from others, and just not really going out and waiting for this to blow over. Some people don't take it as serious as others. Some people, when we try to reschedule them and turn their regular routine visit within the office into a telephone visit, they said, no, I still want to come in to evaluate this or that. Usually would be things that aren't really that emergent, but they just are kind of old school. These are senior citizens, so they're used to still having the traditional office visit where they come in person and have vital signs taken right then and there and be evaluated and be touched by the physician. so they don't really want to do telemedicine visits. But when they get there, I try to make sure that I really explain to them how serious this is and how much of a risk you are taking when you do get out of your house and come here for a physical doctor's visit. And when I explain it, pretty much almost all of them understand. You know, we're hitting the back end of the flu season, and then also this is the front end of the allergy season, pollen season. So a lot of people are developing symptoms that could either be due to the flu. I had at least 2 flu cases within the past 2 weeks. And then, you know, a lot of people have allergy symptoms, allergic rhinitis, hay fever. These things can kind of overlap and present in the form of certain symptoms that people can have or develop when they have COVID-19 infection. So a lot of it is just kind of triaging over the phone. You know, we advise patients to call instead of just coming in as walk-ins. So I talk to them about their symptoms and try to really decipher, you know, what they might have most likely. Do they have allergies? If they have COPD or asthma, are they having some kind of an exacerbation or an attack due to that? Do they have a sinus infection? Do they just have one of these common colds that's going around?
For how many days?
Or, you know, could they even have a pneumonia, which a lot of older patients are susceptible to as well?
Look out for an antibiotic. I'm going to send an antibiotic
So
to the pharmacy.
a lot of it is just really clinical judgment and really listening to the patient, and then just making the best decision possible that you can make. And of course, when a patient gets any kind of symptom, they're just going to assume that they have COVID-19 because that's all they've been hearing about on the news. So I'll be getting a bunch of calls of patients saying, I need to be tested for COVID-19 right away. And, you know, at our clinic, we still do not have the kits right now. And, you know, right now it looks like there's a plan for them to deploy multiple centers and locations throughout the country where they can do mass testing for COVID-19. But right now we're just trying to weigh different options, you know, because you could have these people come out of the house and risk exposure for themselves and to others to go get tested and find out that they have a virus that, you know, the management is basically the things that we would do if we didn't know that they had it, in terms of quarantining them and then maybe just giving them medications to treat individual symptoms. Or, you know, for a public health benefit, from an epidemiological standpoint, you could really focus on trying to get everybody that has symptoms tested to kind of find out exactly how many cases there are, so you can scale this, and from the perspective as a nation, we'll have a better idea of exactly how bad this outbreak is. It's definitely a decision that we have to weigh. A lot of my day is really just spent reassuring patients. You know, everybody's on edge right now, rightfully so. And this is this unfamiliar territory. We don't know what's going to happen in the next few weeks. We are hoping that we're going to get through this and that it's not going to get that much worse. But then when you hear some experts talk, they say that, as a matter of fact, things could get worse before they get better. And we don't know exactly what that means. So I just have to let them know that, you know, we're going to get through this and that we as an organization and as a clinic are going to be there for them. On some days when my wife is not working, then I go in all the whole day and I do my phone visits, my telemedicine, and checking up on patients. However, the kids are out of school too, and I have 2 small children. One of them is in kindergarten. So on the days when my wife goes to work, I need to help him with his e-learning and make sure that he's still, you know, advancing in his studies. So I have to juggle that along with still doing some phone visits and checking up on patients throughout the course of the day, just because we just don't want any of our patients to slip through the cracks throughout this outbreak. But then there's definitely different layers to it, because the younger son, he goes to a babysitter, and that babysitter is at least 60 years old. So that's somebody in a high-risk group that's susceptible to serious illness if they are infected with COVID-19. So then I think about how I go to work every day in a clinic with, and you know, as a healthcare professional, definitely a high risk of exposure. And then I go home to my family, and there's a high risk of exposing them to something, and and then I send this little one over to the babysitter, and things can be transmitted in that way. Now, up to this point, he hasn't shown any symptoms of anything, and neither have I. So I think everything is okay, but these are the type of things and the type of decisions that that ride on our mind day after day. And it's because this is a very unique situation, and we haven't really been in a situation like this before. So with every passing day, we're kind of just adjusting and trying to figure out exactly how to handle everything. But we're learning on the fly, and I think at the end of the day, it's going to make us all resilient and better people for it. Here in Atlanta, the cases are increasing day by day, just like everywhere else, really. But we're trying to deal with it, and for the most part, I don't feel like there's an overall sense of panic necessarily. There definitely is some worry and a little bit of anxiety on the part of people, but I haven't seen any kind of chaos ensue so far, and hopefully it stays that way. Right now, the name of the game is just trying to take care of myself and my family, and also protect myself, whether it be out in the regular world or even just at work, so I can remain strong and be there for others. Because at a time like this, my patients need me more than ever. I'm on the front lines. This is what I signed up for. The meteor is coming, and I gotta be one of the people helping us hit it head on.